Hello and welcome to Talking Shit About. I'm your host, Elizabeth, and each month I bring on a guest to talk about something they love, something they hate, and hopefully by the end we've all learned something. This is our first rerun episode. I have some more information I wanted to add, so I figured with the election coming up and this being a hot topic, we'd go ahead and replay this for you again with some new information. I recorded this episode with my friend Rachel, who at the time was working for my local health department doing harm reduction and outreach, and so I think she is a great person to explain this topic. And if you didn't listen to it last time, I hope you stick around because there's a lot of misinformation clearing up that we do in this episode. So without further ado, let's go ahead and talk some shit.
I was like, what the fuck does that mean? I have friends that are firefighters and I know that they use soap.
And she was screaming at me over soup.
Fuck this, I am not ever talking to a Scientologist again. These people are all insane.
I'm putting my bricks in the dumpsters, motherfuckers. Do you see me, bitches? I'm throwing my bricks. And he's just like chucking bricks.
Hello, everyone, and welcome to Talking Shit About. Today, I am here with my friend Rachel, who works in harm reduction services here with me in Tillamook County. Rachel, welcome to the show. How are you doing?
Hello, I am doing good. Thank you so much for having me. Really excited. This is my first podcast.
Woohoo! Yes, I'm so excited to have you on as a guest because I've heard you present on the, well, A, you're just an amazing person, but B, I've heard you present on this topic that we're going to talk about for, and so I know you're knowledgeable. I know you have a ton of experience, and yeah, I'm very excited.
Yeah, no, my last 2 years in my public health career have mainly been focused around fentanyl and substance use and just harm reduction, especially in rural communities. So I am not new to this conversation, and I'm excited to have it at least on a platform where I can send to other people. There's a lot of misinformation around fentanyl and, just our drug supply in general, as well as what harm reduction is and isn't. And this conversation can only happen so many times by me. So it's really great to have it on, a recorded platform for other folks to kind of, hear the facts. There's a lot of information in the media and just politicians and everyone else who has their own opinions on it. So it's always nice to, have a platform to just speak truth.
That is so true. Yeah, and then next time somebody asks you about fentanyl, you can just be like, here's the link, go listen.
Yes, exactly. I was talking with a friend who's teaching an Addictions 101 course in Portland as an adjunct professor, and I had mentioned to her today that I was doing this, and she was like, "Oh my God, send me the link. I'll have like my students, listen to it and do a synopsis. Like it'll be an assignment." So, really excited to see what we can do with this.
Awesome. All right, well, let's just go ahead and dive right in. We've got some ground to cover. So, what exactly is fentanyl?
Yeah, so fentanyl is it's a big one. It's a powerful synthetic opioid. It's similar to morphine, but when we say similar, it's like similar effects. However, it's 50 to like 100 times more potent. It was originally created for to treat the pain in cancer treatment patients. So it had a job and it does it damn well. Fentanyl is it's got a short life. It's fast acting with a short life, meaning that it goes to work really quickly and it goes out of your system really quickly, meaning you're gonna need more of it. Meaning it's got a higher chance of being addictive. So, why are people using it and why are they choosing to? Well, it gets you real high. It does a good job at what it was originally created for. And anytime that happens, there's always the chance of, misusing something like that. So fentanyl originally created again for the treatment of cancer patients. However, what we are seeing now is synthetic opioids that are being, the chemicals are being synthesized in China then they're being sent over and being created in Mexico, which are then being drove over our borders and then distributed and poisoned into our entire drug supply.
So, data from federal agencies tell us that most of the drugs, specifically fentanyl, that are smuggled into the US are from legal ports of entry. Also, worth noting, over 80% of people prosecuted and convicted for drug trafficking offenses were US citizens. So, this election season, as you hear people say, oh, migrants are bringing drugs across the border, it's American citizens doing it at legal ports of entry. So keep that in mind this voting season.
Any drug you get off of the street, if it doesn't come from your pharmacist with your name prescribed on that orange bottle or whatever color it comes from your pharmacist, you can assume, and you should assume, that it has fentanyl in it. And it's caused all our overdose deaths in the state, in America, to double since 2018. And now in 2024, we're on track for our 2023 numbers to have doubled 2022. So that's doubling every year, not just like, oh, every year since 2018. So these numbers are just getting astronomical.
So what forms does fentanyl come in? I've heard powders and pills.
We're mostly seeing it in powders and pills. There are patches of fentanyl, so I will give the caveat because it always comes up. Someone always wants to bring it up. There absolutely are transdermal patches for fentanyl, just like there are like a nicotine patch you can think of, right? So something that is created very specifically and formulated in a way that it will go through your skin's barrier. So those do exist. Those are heavily monitored in medical settings. In Tillamook County, where we're at, I have not, in the 3 years I've been doing these trainings and been in this work, I've not heard a single first responder, anybody share out a story where they've been on an overdose call because of a patch. So really what we are seeing and what's happening in our drug supply is powders and pills. And it's powders being pressed into pills. And so this powder, as small as a grain of salt, is the amount of a novelty user it takes to overdose and to cause death. And so when we say a grain of salt, we say novelty user, we're talking about folks who are not choosing to use opioids daily. They have no tolerance in their system. In their mind, they believe that they're doing something like cocaine, or, they're taking a friend's Xanax pill, but it's not a friend's Xanax pill. It's a pressed bar that's actually just fentanyl powder. And if you have zero tolerance, it takes maybe a grain of salt amount to cause an overdose. So it's extremely detrimental because nobody's really getting an experimental phase. Nobody gets to experiment with drugs. There is no safe supply at all anymore.
What color is it usually?
It comes in all different colors. Mostly it's a white powder, white to kind of maybe brown. It can come in kind of a crystal form as well. However, we've also seen purple and blue fentanyl powder has actually been really popular in the state of Oregon and in Tillamook County. So it comes in, it really, back especially during the pandemic, we heard a lot about rainbow fentanyl. So it coming in all different colors. I've seen, public health reports come out about green fentanyl in certain counties. So I think it really is dependent on where you're at and what the trend is of the time. But mostly it is a white powder.
Okay. And I want to go back to how quickly you can overdose because A, that's terrifying, but B, there are some myths surrounding overdosing with fentanyl. I can't remember exactly when it was, but I feel like there were a ton of stories coming out in the news, like a cop opens up the trunk of a car and overdoses from being near fentanyl and stuff like that. So what do you have to do in order to get what are the words I'm thinking of?
Experience an overdose.
Yeah, thank you.
Yeah, so on record to date, there is not a single person who has overdosed from touching fentanyl or being around it. So all of those, OPB actually did a really great article where they went back and examined a lot of those stories, right? Because there were a ton of those coming out. Because really at first, when we did hear about fentanyl, we didn't know a ton about it. So we had assumed that it could go, you could absorb it through your skin, and it was a danger to be around, even if it was in the air and someone was smoking around it. We had those thoughts because we didn't know a ton about it. It was new and it was scary. Well, we have studies and we have science. The University of Washington, I think, was the first one to put it out there, but others are following suit. I'm actually working with OHA right now to create their fentanyl exposure resources to share out across the state. There is no on record overdose of any law enforcement or person overdosing from touching fentanyl. So they went back, OPB went back, and they examined a lot of those stories, and they looked at what happened with the officers, right? So they were in a locker room, they were exposed to fentanyl somehow by either touching it or the bag opened in the locker room. So what happened? Their heart rate started pounding. They may have fainted. Really, when it comes down to it, and the toxicology reports coming back with 0 opioids in their system, they had a panic attack. And rightfully so, because again, we have been telling people that you can and will die if you touch it, because we didn't know, the misinformation was so far out of our reach. So a lot of those reactions and a lot of those stories you heard, all of the toxicology reports that have come back from those reports, not a single one has come back with opioids in those officer systems, meaning it was never ingested in their system, meaning they were never overdosing to begin with.
How are people ingesting fentanyl? Is it mostly smoking?
Yes. Smoking is kind of taking in a pill form. So just ingesting it in a pill or powder, snorting it is another pretty popular way. Unfortunately, there was this really weird shift. And I guess it's been like this for a while, and I'm just newer to fentanyl. I came into harm reduction when fentanyl was really big. So fentanyl is truly all I know with harm reduction. And some of my older harm reduction pals who were, back when heroin was pure, the drugs were just different, and the way that we treat things are different. So typically there's this misconception with people who use drugs that smoking it is safer and that you cannot overdose while smoking it. So when fentanyl hit the scene and fentanyl was being introduced into folks' heroin and they were injecting it and they were overdosing, folks started to actually switch to smoking their drugs instead, because in their minds they thought it was safer and that they could not overdose. However, you take too much of any drug anyway and you will overdose. It was just a really interesting shift with fentanyl that people, and to this day at the exchange that I work at, we have people who come in and tell us that they're going to smoke because they don't think they can overdose, or like they were told that they can't overdose if they're smoking, which is always a good education piece, and just, a good, hey, well, why don't you take extra Narcan just in case, right? And so you can help your buddy out. And it's always just a good touch point. But a lot of people are smoking their fentanyl. We on the West Coast are fortunate enough to have a year to year and a half lag of the East Coast. So typically they predict our trends. So things happen there before they kind of trickle down over here to us. And we unfortunately are starting to see on the East Coast, a lot of people are starting to inject their fentanyl. So smoking it and that route is not getting it into their system enough. And so injecting is like the next step up, which is really unfortunate, but it is a way that drugs do kind of trend. So we're kind of expecting to see a lot more folks injecting their fentanyl on the West Coast. Right now, I think it's mostly smoking.
And we touched on it a little bit, but how exactly does fentanyl affect the body? Like, what kind of high are people experiencing?
I mean, it's pretty euphoric. It's like morphine. I mean, trying to think. I mean, it's just extreme happiness, drowsiness, confusion. But the big thing is that it's, it's an opioid, and opioids affect breathing. And when you have too many opioids in your system, so opioids bind to the receptors in your brain that control the autonomic functions of your body. So your breathing, blinking, heart rate, blood rate, like those kinds of things, those receptors are in charge of. When you put opioids on those, it makes it a little blurry. And so you can have a hard time breathing. And just like normal body functions can typically have a hard time. So that's why some people can get nauseous or have diarrhea. It just affects certain parts of your body, opioids do. But when you have an overdose of opioids, so when you have too much, they bind to those receptors and it starts to weigh them so far down, it drowns out those functions. So you stop breathing, your the oxygen stops flowing to the rest of your body, and that's when you go unconscious, and that's when you can, die if nobody intervenes at that point.
And do you know of any long-term side effects from fentanyl?
All substance use at a core is going to take effect on all of your body systems. I don't have specific effects because I think unfortunately we haven't really seen a lot of long-term effects. This fentanyl pandemic is so new, and so we may have some folks who, from just long-term use in controlled settings or other, situations, but truly we haven't seen fentanyl on this level. It started in 2018 and it's just gotten so much worse. And unfortunately, I don't think that there's a lot of people, and I hate to really say this, but I don't think there's a lot of people that are going to survive this long enough for us to really study the long-term effects, if we don't do something now. So it's unfortunate, but I mean, what I can say about fentanyl and its effects is that it's an opioid. So you build up tolerance to it in ways that you wouldn't other drugs. So when you have an opioid added into something like methamphetamine, that isn't something that the body necessarily is going to create a dependence to, but then you put an opioid that your body physically depends on, you start to see these people who are now physically dependent on methamphetamine. And it's now harder for them to get off all drugs, not just fentanyl, but they can't get off of now meth, or, whereas other times they could walk away, or there were other means of treatment and things that worked. So that has been making it really, really difficult. We've not seen the level of physical dependency on drugs that we have since fentanyl has been introduced.
Have you ever heard the term hot shot?
Okay, so no, I had not heard it until you texted it to me. So I looked it up. And it looks like, unfortunately, it was like the slang way to say that like your drugs are laced, right? And like that's like the way I'm saying it, because it looks like people said hot shot, meaning they knew that the heroin had other drugs in it. Today, I would say everything is considered a hot shot, except for people are not being told that or are not expecting that.
Yeah, from my understanding, and this is something like I've heard at work, I have no idea how like widespread this is or if it like changes depending on the demographic that you're talking to, but and for context listeners, I work in homeless services, but a hot shot is like, you're right, something that's laced intentionally, but the intent, again, from like the conversation that I had, the intent is like death, is intentional overdose.
Oh, okay. So yeah, that's not something that I guess I was hearing, because that's the thing. People ask me all the time. I do overdose prevention trainings, and I've done over 40 at this point. And I've trained over 800 and something individuals. So a lot of different folks and stuff. Okay. And then that's like, oh, sorry, I was like, where am I going with this? And that's like one thing that gets brought up almost every training I go to is people ask, well, are people overdosing intentionally? Like, are they doing it on purpose? I've never met someone at my exchange that truly wants to overdose, right? They do not like, it's not something that they, feel they can control. Even when we give them Narcan and we give them everything, it doesn't always work. And they've seen that firsthand. So none of these folks that I'm working with want to go into these and like not wake up. That's never been a conversation I've had. And that's always a question that comes up, because working with like our Prime Plus peers, one of the things that they share that I think is a really hard concept to grasp, but once you do, it kind of opens your lens to harm reduction, is that being really high on an opiate or like heroin is so close to death. Like that really high good feeling is just so close to death, but you're not there, right? You're not wanting to die. You just want to get close. You want to feel that warmth, and then you want to come back to the world. So that's a really, delicate place. But again, people don't want to die and they don't want to slip over into that place, but people have a hard time understanding how they can let themselves get there and not want death. Like it's truly an interesting concept. But yeah, that was something that really opened my eyes, is that, being really high on heroin is really close to death. And when you reverse someone in an overdose, a lot of the times they're really confused. They might lash out. They may, be really pissed off at you, because what naloxone does in an overdose is it puts you into opioid withdrawal, which is a really shitty feeling. Like your body hurts, like everything sucks. You're back to, and this is the thing, you probably have zero idea in that moment coming to that you were actually not breathing and you were unresponsive, right? You're just upset because someone fucked up your high. And, in 20 minutes, once you realize and you de-escalate and you explain to this person and they realize that you just saved their life, they're going to be a lot more thankful. But it may take that 20 minutes of de-escalating, because again, they are going to have no idea what just happened, or the fact that you probably just brought them back to life.
Hey, Elizabeth here. The word I was looking for earlier was murder, as in people are murdering people with hot shots. So it's an intentional overdose of somebody else. I didn't articulate that very well. Either way, if someone offers you drugs, probably don't take them. If you're going to take them, get them from someone that's reputable. And if you're going to buy weed, buy it from a dispensary, because you never know what's in it. Okay, back to the interview. Well, this is a good segue into talking about overdoses. I think you already kind of covered how an overdose occurs, but let's say you are out, could be anywhere, and you see someone and they're unresponsive and you suspect it might be an overdose. What do you do?
So the first thing is, if someone's unresponsive, I'm hopefully with someone else. And if not, I'm calling 911 or having them calling 911, and I'm immediately going up to the person. If they're unresponsive on the ground, or like they're somewhere, I'm going to try and put them on the ground in a safe place too. I'm going to assess my scene first off as well. I'm not going to do this if like there's weird, I'm going to make sure my safety is important as well, because I don't want to cause harm to myself or others if I'm responding. So I'll assess my scene, call 911, get down on my hands and knees, get this person on their back, and then I'm going to really make sure that they are truly unconscious. So if they are not breathing, or if they are breathing, so that's the thing, is if they're in like a deep nod, so they're still kind of responding every couple words, there's still a couple breaths coming out, but they're shallow. I'm going to stay with that person. I'm going to monitor them, and I'm going to make sure 911's on their way, because that person could slip into an overdose. And I, just want to make sure that they get medical attention. If they truly are unresponsive and they're unconscious on the ground, I'm going to get down on my hands and knees, and I'm going to do a nice sternum rub I'm going to take my knuckles, and I'm going to really aggressively rub their sternum, right in between their chest, pretty hard, because that's going to, sometimes you may come across someone who is napping, or who has, maybe does live out on the streets and has been harassed by people telling them to, move or whatever, so they don't want to respond. So if you do a sternum rub on someone and they truly are unresponsive, you then know you need to get into action. If they wake up and go, hey buddy, move on, right? Like move on, apologize, and get going. But if they truly are unresponsive, again, we hope 911's already being called and on the way. At that point, I'm going to go ahead and start CPR. So I'm CPR certified, so I'm going to do 30 compressions to 2 rescue breaths. If you are not CPR certified in these situations, but you come across someone who is unconscious and not breathing, rescue breaths are some of the most important things that you can do to keep someone alive. It just keeps the oxygen flowing to them. Even if you don't feel comfortable in like the chest compressions, that's okay. Two breaths every about 30 seconds, and really making sure you're lifting that, tilting that chin up, you're plugging that nose, and you're really blowing firmly in, trying to get the oxygen into their lungs, can really help and give some time for the first responders to get there. So I'm going to start 2 compressions, or 30 compressions to 2 rescue breaths. I'm going to do about 2 rounds of that. and then I'm going to go ahead and administer my first dose of Narcan, naloxone, whatever you have. We give out injectable as well as nasal. I give out nasal to all of my community partners and to mostly general public. Trying to ask anybody to inject anything into anybody under any circumstance is quite a lot, especially when it's a traumatic situation like an overdose. So unless people ask for injectable naloxone, I give out nasal Narcan. So I go ahead and pull out I carry my little kit with me, and it's got my little CPR mask and all of my little kits of Narcan and all my other goodies that I need. So I'd go ahead and pull out a dose. While this person's still laying on their back, I would go ahead and give a full dose, 1 dose of Narcan. And then at that point, if they do start to come back to and breathe, I would go ahead and put them into recovery position. So you lay them on your side, you bring their top arm up and over, and then I think it's the underarm goes up and around, and then you bring the knee up. Recovery position, look it up. I am terrible at explaining it. I usually just sprawl myself across the floor, but that doesn't help on a podcast. But you want to put someone, if they do start to come to in that position, when you do reverse an overdose, folks can have all kinds of symptoms. So they're going to have, probably body aches. They're going to have chills. They might throw up, all kinds of symptoms. So you really want to get them into recovery position, especially if you're not going to continue on with CPR, because if they do come to and throw up, you don't want them choking if they're on their back, because then you have 2 crises now. And first responders, at least in my county, no shade to them, but it can take up to like 30 to 45 minutes to get there. So 1 crisis is enough in that time frame. But at that point, you would just stay with that person. It could take more than 1 dose of naloxone to bring somebody back. Unfortunately, we are hearing that that's normally the case. In Tillamook County, it takes typically anywhere from 4 to 5 doses to reverse an overdose. However, there are still overdoses we hear that are reversed with 1. So you always start with 1 dose of naloxone and you wait 2 to 3 minutes at a minimum between each dose, really giving it time to work.
You did already kind of mention what Narcan is. Can you also use it on pets or children?
Yes, right? So Narcan is safe for youth, for babies, infants, for pregnant people. It is safe for use on almost any human. There are very, very rare side effects. I've never heard of any during my trainings or heard of anyone sharing anything like that. So there are those very, very rare instances of that. It's not approved for use on animals. However, I was in a training at the end of last year, and one of our first responders, a fireman, shared out that they used Narcan on a dog during one of their calls recently, and it revived the animal. And then I shared this at another meeting recently, and another law officer shared the same thing and said, oh yeah, there was another call like that, and we used Narcan on the dog, and the dog came too. So I've heard of 2 anecdotal local stories of it being used, and I believe them, just because of the science behind the way naloxone works in the brain and like how it goes to find the opioids and the receptors. But I am not going to be quoted on that because they're not my stories.
So if you give Narcan to somebody who's not overdosing, is it going to affect them in any way?
Nope, it will cause absolutely no harm to someone who's not experiencing an overdose in the entire county of Tillamook, and honestly, I bet you throughout the entire state of Oregon, but especially here in Tillamook, I can speak for them. On all calls where there is an unconscious person, first thing first responders do when they get on site is administer naloxone or Narcan. It is safe. It will not harm anyone if you do not have opioids in your system. And if you do have opioids in your system, it's going to give the paramedics or the EMS a better idea where they should start their care. So especially if you are with somebody and you call 911 and the EMS does show up and you're still with that person, the first thing you should explain to them is, I have been here for 20 minutes. I have given 3 doses of Narcan, 2-3 minutes in between. We've done this much CPR. You're communicating all of that with them because it's going to give them an idea. Okay, well, maybe it isn't an opioid overdose, maybe it's an overdose from this, and they can start on their processes a little bit better. Like they just have a leg up in saving that life.
And where can people find Narcan? Like, where do you get it?
The state of Oregon, anybody can walk into any pharmacy and you can walk into any health agency, and essentially the law says that any provider should be able to write you a prescription for naloxone, and then you can go pick it up at your pharmacy. So when I say write you a prescription, that's usually what requires your insurance to kick in to pay for it. So if you have if you have a prescription, typically almost all insurances will cover it. So then that's free. In Tillamook County, anybody can walk into any Adventist Health location and ask for it at their front desk. They have a community supply, and so it's at all of their front desks. So Manzanita, Pacific City, and in Tillamook proper, you can walk into any of those locations and ask for it at the front desk. I walked in and asked for a case, and they're like, "Yes, ma'am," and let me walk out with a ton. So anyone can go there. And then there's also, I think, 5 or 6 locations in Tillamook County where we have nalox boxes. And so those are just those are boxes that are kept on the outside of buildings. So they're available 24/7 to anyone in Tillamook County or anyone anywhere who needs naloxone, who can get to those locations. And so there's one outside of the health department's new public health building, and that's in Tillamook. There's one outside of Care Inc. in Tillamook, Serenity Club in Tillamook. Rising Hearts Studio has one up here in Nehalem. And oh gosh. Oh, Tillamook Veterinary Hospital. That's another one. That's a newer one I just got put in. And I'm
Awesome.
really excited to have them have their box up there. They invited me in to do a training. They're pretty close to where some of our camps are. And they just want to kind of help however they can. So they've been a really cool partner in getting that nalox box put up, and people have been using it and taking Narcan from them, which is really great.
For listeners who are not in Tillamook County, would you recommend maybe going to like the local hospital or health department?
Yeah, I would say reach out to your health department if you have. I mean, I would also just look up if you have a local harm reduction agency. Depending on where you're at, especially if you're in a bigger city, there's going to be a lot of nonprofits that can do this work that have put money into it, and those are going to be a better place for you to probably get free items. If you're closer, like the Portland area, Inside Out is amazing. Multnomah County's exchange and all of their resources are great, but Inside Out is really doing some amazing work. They have a drug checking machine that is open to the public, so you can take your drugs there and get them tested. No, anonymously, no judgment. And it's really cool. They've got some really great advanced stuff going on with peers. And they're Portland, so they have treatment and they have, real referral loops that like lead places, which is amazing. So they're a really great advocate there. But I just say reach out and do your research about who's doing local harm reduction in your area. We are very fortunate in Oregon to have the Good Samaritan law that protects anybody who responds to an overdose in good faith. As well as folks who have, certain, and it protects folks from certain drug crimes as well, or, penalties and things like that. It's really unfortunate because I have to make it very clear when I talk to people that that's Oregon's Good Samaritan law. Idaho just created laws that make it harder for general public to actually have and carry naloxone. I think only paramedics and licensed medical providers can now carry it around. So it's really scary what people are doing and why they're trying to police Narcan for whatever reason. But we're very fortunate to be able to have solutions in our own hands and take care of our neighbors. And so I think everyone, if you are able to and you feel so inclined to, I think everyone should carry Narcan and know how to use it.
I carry it always, all the time. One of the highlights of my bachelorette party is my bridesmaids took me on a scavenger hunt throughout Missoula, and we were on campus at the university and they had a Narcan booth, and I was so excited and I
Hell
stocked up on
yeah.
Narcan and test strips and like everything. Yeah, all about it. You never know where you're gonna find it.
Super cool. You never know
Yeah.
who you're going to run into who may need it. I've run into people out here, like people want to act like it doesn't happen out here. I've been in restrooms where girlies are snorting stuff off of keys. Like, it's happening here. It is here in these bars, right? Like, it is happening in our community. And, to turn a blind eye, it means that we would possibly lose a community member. And I'm not ready to do that because, who am I to judge?
Rachel, you're so good at entering into our segues. You've said the term harm reduction a few times. What is that?
Oof. Harm reduction is loving people and meeting them where they're at. It's a range of intentional practices that we do to lessen the negative social and physical consequences that are associated with substance use. So we hold the exchange mainly in the way that we explain it to constituents and to our commissioners and stuff is that we're reducing harm by reducing the prevalence of disease. So we help people not share supplies by exchanging it for them and getting them clean supplies. We acknowledge that drug use is a part of our community and that we don't have enough treatment or referral loops or those kinds of resources to take care of that. So we need to reduce the amount that it drags on the rest of our systems, like our hospital system. We need to make sure that, folks aren't going to the hospital all the time for, abscesses and wounds that are festering because they are, sharing supplies with people. They have the right ability to clean their own wounds without having to go to the ER every time they need something. We want to make sure that, we have plenty of Narcan given to folks so they can reverse overdoses in their own community when they don't feel safe to call 911. It's about acknowledging that people are what are I trying to say? So self-autonomy, right? That you get to be in charge of what's right for you. And we're just here to help educate and give you the tools you need to make your best choices. So our exchange is anonymous, it's free, and we like to consider it a safe place. So people come in and the only real, lecturing, if you will, that we do at folks is we give education on fentanyl and fentanyl test strips when we give those out and just making sure people understand that fentanyl is in everything. And then we talk about, why we don't want people to share supplies. So we, talk about how it can reduce the amount of abscesses and wounds and, disease that is spread. And so those are the only two real touch points that we, if you will, push on to people. The rest of it is just, okay, now what do you need? What are you working on? What can we help you with today? And a lot of the times for the first 2 or 3, it's just they come grab supplies, they barely look at us. In our intake forms, we'll ask questions, about what substances do you use and those things, and they'll say nothing. And then by the 3rd, 4th, when we've held that space and we've created, such a safe space, they come in and they finally like, okay, so I have a tooth, and they'll open up their mouth and you get to, see what actually needs taken care of. And you're just like sitting there, like quietly in the back of your head, you're like, yes, I'm in, like, because you've built that rapport finally, because it's you know that every time they've come in, they've wanted to say something. They just don't know if they can trust you yet. So it's just building up that space, creating that safe space for people to come back to. We don't hold people accountable to really anything but themselves. Everyone else is holding them accountable for everything and putting consequences and saying, if you don't do this, then this. That's not us. You can come see us or you don't have to. You can, we won't see you for 3 months and you'll come in and we'll be like, hey, it's great to see you. What do you need today? It's not like this big, well, where have you been? And this whole story, it's just, it's good to see you. Come on in. And people feel safe in that space. So we just try to continue to create that because, that's not really being created anywhere else. And it seemed to work. We just had a success story, really unfortunately, when some of our exchangers don't come in for a few months. Typically, that means they've overdosed and passed. And there was one that we hadn't seen for a while, and we were getting really nervous. and we reconnected with them pretty recently at a separate community event. And they were so excited to come up and share with me and Jennifer that they are no longer injecting drugs anymore. They've now switched to smoking, which is a safer choice for them. They had all kinds of wounds and just some really, really unfortunate stuff going on because of the injecting. And they almost all but healed at this point because they have been, abstaining from, injecting and have switched to a safer method because they felt, they were safe to do so and, excited to share that with us. And that is a huge win for us in terms of harm reduction is that, this person is happy with their choice and they're doing better because of it. And at some point, I'm sure it will lead to them abstaining from use altogether if that's what makes sense to them. And if it's not, we're still beyond excited for them.
That's awesome. Rachel, I appreciate the work that you do so much and your attitude while you do it too. It's great.
Thank you. Well, it's my community, I want to give back. I live here. And the more I give back to it, the better my neighbors are for me and the better my community is. So it just, it all adds into it. And I mean, it's people like us, because I mean, you do it too. Like, it's people like us that are going to change this community for the better. And like, they need us. They do.
Mm-hmm. Well, Rachel, do you have any closing thoughts before we wrap up?
Just, support harm reduction, love people who use drugs, and take care of each other. Look out for your neighbors.
Perfect. Rachel, thank you so much for coming on the show. I really appreciate it. And again, appreciate all the work that you do.
No, of course. Thank you so much for having me.
That's a wrap for this month's episode of Talking Shit About. We'll be back in November with some new content for you. And speaking of November, it's voting season. The only candidate that this podcast supports is Vermin Supreme. If you haven't gotten a chance yet, go check out our last episode on Project 2025. And when I say our, I mean mine, with my husband, Gil. You can learn more about Project 2025, who's behind it, and what potential policies and such would look like under a conservative administration. Our two-party system is broken and everything is fucked up. But if you want to vote to make yourself feel better, go for it. I support you and I support Vermin Supreme. So with that, we'll see you next month.